Hi, I'm Dr. Vikas Tandon. I'm a consultant spine surgeon at Indian Spine Injury Center, and I've been working here since 2007. It's almost going to be 16 years now since I've been working here as a consultant spine surgeon. You must have seen a lot of patients, especially children, who would have a deformity in the coronal plane and they would look badly deformed. Now, scoliosis as such can be of multiple etiologies. The most common being the adolescent idiopathic or idiopathic scoliosis, which happens to a lot of children, and that is why we have all these screening programs in schools to screen these patients, because many a times parents do not, they don't see this deformity coming up, and that thereby when they actually see the deformity is quite grotesque, which needs a surgical treatment. So if you catch these patients early by screening in these schools, they can be treated earlier with braces and they can avoid surgeries usually. So basically scoliosis can happen because of idiopathic, where there is actually no reason, but it happens to a lot of adolescent patients, or it can happen newborn patients as well. These are early onset scoliosis patients. And then we have another set of patients who have congenital scoliosis, which is because of some congenital defect, that is at the time of birth. When the patient is born, there are certain defects which can present later as scoliosis or deformity in the spine, in the coronal plane in such patients. This could be a bar, it could be a hemivertebra, it could be a block vertebra. All these congenital defects can lead to a congenital scoliosis or a congenital deformity. Now, when we talk about congenital scoliosis, these patients usually require surgical intervention, and that too at a very early age, mostly at the time of diagnosis. And there are multiple surgical options that are available to treat such patients. When we talk of idiopathic scoliosis, which is caught later on, or there is no actually or hypothetical causes which are there, these are mostly managed with braces and physiotherapy. But if the curve which is there, that what we call as the Cobb's angle, goes beyond 40 degrees in the thoracic spine, or if it goes beyond 30 or 25 degrees in the lumbar spine, then we offer surgery because of cosmetic reasons, because of reasons which can lead to defects in or difficulty of functioning of organs, internal organs later on if the deformity progresses further. So hence scoliosis needs to be seen properly, needs to be screened properly, and needs to be treated properly. Thank you so much.